Hi, my name is Elizabeth Choi, and I am going to be presenting case 401. So I have a patient that came in with a sore throat, a nasal congestion, shortness of breath, and a fever for last several days of the week. He thinks that it was because of the flu, and once he started feeling better, he went to work out, and then he had at 5 a.m. in the morning, he had other symptoms of shortness of breath. He came into the ER with these symptoms. And looking at his symptoms, and it was diagnosed that the patient had a flutter. So we're going to treat the same way as if the patient had atrial fibrillation. And since the patient is hemodynamically unstable, his blood pressure is lowering, and he's having signs and symptoms, we will do an immediate electrical cardioconversion in addition to an IV anticoagulant, which is enoxaparin 80 milligrams bolus, followed by 1 milligram per kilogram every 12 hours. Hopefully, this will convert the patient to normal sinus rhythm, and we need to monitor his 12-lead ECG to check for his normal sinus rhythm. His goal would be 80 beats per minute at rest and lower than 110 beats per minute after exercising. Then I would discontinue the diltiazem because the patient has heart failure and reduced ejection fraction, and in that case, we wouldn't use a calcium channel blocker because it might make the patient's symptoms worse for heart failure. Again, we will monitor the same way, and to prevent future aflutter and for rate control, we would initiate amiodarone, 150 milligrams PO daily for rate control and maintenance of his atrial flutter. And again, we would do a 12-lead ECG to check for normal sinus rhythm. We would check first the PR interval to make sure that they're equidistant. Heart rate goal of less than 80 beats per minute at rest again, and heart rate of 110 beats per minute when exercising. And we would like to check his QT interval. But normally, amiodarone doesn't really cause much torsades, so it should be okay even if the QT interval is over 530. And we would do chronic amiodarone monitoring, and we would also check for electrolytes, magnesium and potassium, because if these get too low, the patient is at risk for another atrial flutter or even an AFib. And after we cardioconvert them, we need to always give the patient an anticoagulant for 4 weeks. And I calculated his CHAT score to be 1 because the patient has heart failure. So I would give the patient aspirin 81 milligrams, 1 POQD for 4 weeks to prevent clotting and for prevention of embolic stroke. And I would have the patient come back in 4 weeks and check his CHAT score again to see what else we have to do from there. And the patient also has hyperlipidemia. He has high triglycerides, but it's not so high that we have to worry about it right now because it's less than 500. But we would still need to monitor it because it is one of the risk factors that could lead to another aflutter or AFib. And that's it. Thank you.